UW-Madison has seen an increase in need for mental health services. Officials say the pandemic did play a role, but even before that, the numbers were climbing.
Grace Hodek has you covered on what they say they're doing to make sure all students feel supported.
The first step in addressing mental health seems simple. Talk about it. But for some, that's easier said than done. UW student Aiden Zimet tries to be a resource for those who need a little push.
I, as a student, have accessed mental health services before, and I know how important they are. So I kind of wanted to be an advocate not only for students that wanted to seek out mental health services, but I also knew how important that these providers were.
Zimet has served on the Student Advisory Board for UW's Mental Health Services for 2 years. He says he's seen both an increase in awareness around mental health and students accessing services.
The pandemic illuminated a lot of problems regarding mental health, and because of that, I think the trends have kind of continued. They're not something that just go away because the pandemic is done.
Staff at UW's Mental Health Services tell me they saw 15% of the student population during the 2021-2022 academic year. That number was at 13.1% the year before and 14.1% in 2019 to 2020. They say the dip in the past years was likely because of the pandemic. So now staff is working to ensure those numbers can climb.
We have been developing and growing an embedded counselor program. We have collaborated with UW-PD to create a co-responder program, and we are partnering with our medical services to do screening for mental health concerns and student outreach.
In the meantime, Zimet has a little advice for those who are nervous to share their stories.
Putting it out in the air and talking about it is the first step. I think that the people around you are there to support you.
In Madison, Grace Hodek, 27 News.